Good afternoon, everyone, and good afternoon, Mr. Hassan. Today, our team would like to present our speech regarding obsessive compulsive disorder. Before we dig in, I would like to introduce all of you to our wonderful team. My name is Michelle Aurelia Wang, and these are my partners, Khalifa Fauzia, Maya Ainaya, Mutia Dwi Setia, Nabila India Sai, Nadifa Kansabila, and last but not least, Najma Amalia. Without further ado, let's get straight into it. Some people have this assumption that clean freak behavior and the desire to keep things tidy are the biggest characteristics of people with OCD. But did you know that it is simply not true? There are still a lot of misconceptions and myths surrounding OCD, or obsessive compulsive disorder, according to an article with the title, What is Obsessive Compulsive Disorder? On APA's website. Therefore, we believe it is crucial for us to bring up OCD as our topic of presentation. Of course, mental disorders are not an easy topic to discuss. Proper knowledge and research are necessities when it comes to informing people regarding OCD. We are students from the psychology department of UNS, and topics surrounding OCD have piqued our interest. We have gone through thorough research using reliable sources, and we will share what we have found. The lack of general information regarding OCD is the reason why OCD is often stigmatized and looked down upon. Therefore, we believe it is very important for people to have a better understanding regarding OCD. In our presentation, we will go through several points, such as the definition of OCD itself, the characteristics and symptoms of OCD, why OCD happens, treatment options for OCD, and case examples of OCD in person.
Definition of OCD. What is obsessive compulsive disorder? First of all, we need to know what OCD stands for. According to an article on APS website with the title, What is Obsessive Compulsive Disorder? Obsessive compulsive disorder or OCD is a disorder in which people have recurring, unwanted thoughts, ideas or sensations which are known as obsession. Together of the thoughts, they feel driven to do something repetitively, which we know as compulsion. Hand washing or cleaning, checking on or other activities can significantly interfere with a person's daily activities and social interactions. This distressing touch and repetitive behavior. For people with OCD, however, these touches are persistent and intrusive. Not performing these behaviors can cause great distress that are often associated with certain fear or consequence. Many people with OCD are yet some believe that these thoughts are true even if it's trouble disengaging from their obsessive thoughts or stopping their compulsive behavior. A diagnosis for thoughts and or compulsion that interfere their daily life. Percent of people in the US in which slightly more women than men are affected. OCD often begins in childhood, adolescence, or early adulthood. Now that we know what OCD is, let's get right into the symptom and characteristic.
The next topic is about symptoms and characteristics. According to an article on APS website with the title What can be divided into two, which are obsessions and compulsions. Let's dive into the obsessions first. Obsessions are recurrent and persistent thoughts, impulse, anxiety, fear, disgust, and many more. Many people with OCD mind and that they are excessive or unreasonable. However, the distress caused by destructive. Most people with OCD try to ease the distress of obsessional compulsions acts. They may also try to ignore or suppress. So, examples of obsessional thoughts are the environment. Second, disturbing sexual thoughts or image. Third, four, fear of perpetrating aggression or being harmed by self or loved ones. Five, from attention to regularity, temerity, or precision. Seven, afraid of losing something or discarding something important. Talk, image, sound, word, or music. And it is mentioned that in our you may be wondering what these compulsions are.
According to an article on the APS website that goes by the title, What is Obsessive Compulsive Disorder? Compulsions are repetitive behaviors or mental actions that an individual feels driven to perform in response to an obsession. The behaviors or acts are usually excessive and may prevent or reduce a person's distress associated with their obsession for a temporary amount of time. Acts of compulsions can also be unrelated to the obsession. In severe cases of OCD, those acts of compulsions may fill up one's daily schedule, which is why a person with OCD may find it difficult to follow a normal person's routine. There are many different acts of compulsions. For example, first, excessive hand washing, showering, teeth brushing, or toileting. Second, repeated cleaning of household items. Third, ordering things in a specific way. Fourth, checking the doors, locks, or switches repeatedly. Fifth, rituals associated with numbers such as counting, repeating, or even avoiding and favoring certain numbers. Sixth, avoiding certain places, people, and situations that may trigger their obsessions and or compulsions. Of course, these are merely examples since compulsions can manifest in a lot of ways.
Now we're moving on to the causes of OCD. Most OCD diagnoses occur at the age of 19 and are more prone to attacking boys compared to girls. Of course, the statistics may vary depending on the demographics. Unfortunately, until this time, experts are still not sure about the exact cause of OCD. However, according to an article that's written by NHS UK, there are several factors that may play a part, including the first is family history. Someone is more likely to develop OCD if a family member has it, so it is possibly because of the genes. Second is brain abnormalities. Some people with OCD have area in their brain that has unusually high activity or low levels of chemical called serotonin. Third is life events. OCD may be common in people who have been bullied, abused, or neglected, and it sometimes starts after an important life event such as childbirth or a bereavement. This condition can trigger the emergence of a good feeling to lead to always do the perfect thing. Fourth is personality. Someone who is meticulous, high personal standards may be more likely to develop OCD. Now we know the many factors that can cause OCD. It is only appropriate for us to know the treatment options that are available for people with OCD.
Previously, we have discussed about the definition, symptom and characteristic, and causes of OCD. And now, we will talk about the treatments of OCD itself. According to an article on APA's website with the title What is Obsessive Compulsive Disorder? Patients with OCD who receive appropriate treatment commonly experience increased quality of life and improved functioning. Treatment may improve an individual's ability to function at school and work, to develop and enjoy relationships, and also to pursue leisure activities. There are three treatments that we will discuss here, namely CBT, medication, and surgical procedures. And now we will discuss it one by one.
Actually, there are many types of therapy or medication that is cure this abnormality that therapy usually used as a promising method. There are so many types of therapy, but for especially OCD, CBT or cognitive behavioral therapy is known as suitable one. Exposure and response prevention or ERP, a component of CBT therapy, involves gradually exposing OCD to feared object or obsession such as dirt and having OCDs learn ways to resist the urge to do compulsive rituals. Maybe it takes effort and practice, but once they do it, they will enjoy the better life. Then they learn to manage their obsession and compulsion. Usually, it starts cause anxiety first, before moving on to more difficult thoughts. Then, let us check the second treatment. For the second treatment, there is medication. Certain psychiatric medication can help control the obsession and compulsion of OCD. Most commonly, antidepressants are tried first. The main medicine prescribed are a type of antidepressant called selective serotonin reuptake inhibitor or SSRIs. it will improve OCD symptoms by increasing the level of chemical called serotonin in their brain. Then let me check some of example the medication. First, there are clomipramine with example anafranil for adults and children 10 years and older. Second, there is fluoxetine, for example Prozac suite for adult and children 7 years and older. There are fluoxamine that's suite for adult and children 8 years and older. There are paroxetine with example Paxil or Paxiva for adults only. Or maybe sertraline with example Zoloft that is suite for adult and children 6 years and older. For your information, there are 3 warnings I will inform to you. Before, it may take 12 weeks before you notice any benefit and mostly take at least 1 year. Nah, besides the benefit that will be given, SSRI still a drug that can give side effect for users. And importantly, when the drug gives hallucination to the suicidal thoughts, OCDs must contact the doctor. Second, OCD who have medication for their treatment prohibited to stop the medication without consult to their doctor. And third, due to the content of drug, SSRI should not be taken by pregnant women, particularly in the first trimester, because it can affect the baby. Then next to the third, treatment.
Now, we will go to the third treatment options, namely neurosurgical procedures. Some newer studies show that gabapental capsulotomy, a surgical procedure, can be very effective for patients who don't respond to typical treatments and are very impaired. But it is underused due to historical prejudice and its invasiveness. The brain stimulations, which involves an implant device in the brain. The brain stimulation itself has data to support efficacy and doesn't permanently destroy brain tissue as done in a capsulotomy. However, it is still highly invasive and complex to manage, and there are limited providers and hospital systems trained to offer this treatment and able to provide the long-term support needed by GBS patients.
Okay, now maybe you guys wondering how OCD manifests itself on a person in real life. So according to an article with the title OCD Case Example on a website called Change Your Thinking, we found few cases of OCD in real life. For the first case, we have 13-year-old boy. He learned in his health class about vomiting was an involuntary response to illness. One evening, he watched a news with his family, and he found the news of a young man who aspirated to vomit while sleeping and died. After he watched the news, he becomes obsessed about getting ill and vomiting. He kicked out anyone who seemed sick at his school, and it makes his friends feel confused because he didn't want to talk to anybody. He always brings his hand sanitizer wherever he goes, and he always avoid all the public toilets. He won't touch the food that he thinks it might be contaminated by germs, and he avoided all the restaurants that he used to enjoy with his family. And of course, his family, especially his parents, became concerned about his attitude. So now, moving on to the second case. So there is a 21-year-old college woman who had a serious date for the first time. Like the most young woman, she wants to look and feel the best, right? And one time while she flipping through a clothing catalog, she noticed that she attracts with several female models. With feeling of anxiety, she wondered if it meant she was a lesbian. She repeatedly asked her boyfriend to convince her otherwise, and sometimes it makes her boyfriend feel annoyed. She avoided to being alone with other women for the fear of losing control and acting sexually. She keeps praying to God for forgiveness, and when the obsessive idea gets triggered, she would always tell herself 3 times that she loved her boyfriend, and she would always remember all the action that her boyfriend had done to make her comfortable.
So we are finally reaching towards the end of our presentation. After all the information that we have shared, we can conclude that it is indeed important to raise awareness regarding OCD. As we have emphasized previously in our presentation, stigmas and myths surrounding OCD can be very damaging. Now that we have understood OCD through a brand new perspective, it is possible for us to break through the many misconceptions about OCD. Of course, the highest form of knowledge is empathy. Simply understanding OCD itself is not enough. As a part of humanity, it is only our duty to understand and support those who struggle, such as people with OCD. We hope that everyone here will not only look at OCD with a brand new perspective, but also utilizes the new insights to encourage, understand, and also raise awareness of how challenging OCD is for some people. As we know from the symptoms and treatment before, now we know how to help people with OCD. We have also included some experiences from people with OCD or case examples to make sure that we are able to further understand and support them. Before we end this presentation, there's a quote that we'd like to share. The quote says, OCD is not cute, fun, quirky, desirable, cool, or trendy. OCD is an anxiety and guilt-ridden, debilitating, frustrating, exhausting, and painful. OCD is not neatness, it is a legitimate illness. The next time you think you're so OCD, no, you're not. You're so misinformed. And for those of you who are currently struggling with OCD or other mental health problems, we want you to remember that those problems don't define who you are. They are something you experience. You walk in the rain, but you are not the rain. That's it from us. Thank you for listening to our speech. I hope every single one of you can get new insights after all that we have talked about.